Welcome to the Boston Echo Board's review course. We'll be going through another sample question from the course, and this question relates to the safety and bioeffects of ultrasound. You'll have one question followed by 4 choices and about 30 seconds to make and choose the correct answer. After which, the correct choice will be highlighted and there will be a didactic discussion related to the concept presented in that question. Enjoy. This question relates to ultrasound exposure during M-mode echocardiography. The entire image has been divided into 4 zones: A as the tissue transducer interface, B as the near zone, C as the focal point, and D is uniformly along the scan line. Now let's go to the question. So the correct answer to this question is choice B, that is near zone. Now when we are discussing the ultrasound exposure, it really is very important to keep in mind that what mode of ultrasound we are talking about. There are unscanned modes such as M mode, the one that was in this question, or the spectral Doppler, or scan mode such as B-scan imaging that we use for visualizing tissues, as well as color flow Doppler imaging, in which the entire beam is visualizing a large surface area. So we will discuss in a little bit more detail what is the difference between the ultrasound exposure in scanned as well as unscanned mode. So in this being an unscanned mode, the correct answer is B. So because the temperature elevation is related to both ultrasonic power and the volume of exposed tissue, we tend to keep in mind whether the beam is scanned or unscanned. In other words, whether the equipment moves the beam or keeps it stationary. That's the most important thing. Scan modes such as B mode imaging, the one we use during routine echocardiography, and color flow Doppler distribute the energy over a large volume. In scan modes, the highest temperature is frequently at the surface where the ultrasound enters the body. Unscanned modes, such as the spectral Doppler and M mode, the one that was shown in this question, concentrate the power along a single line in the patient and deposit energy along the stationary ultrasound beam. Energy is distributed over a much smaller volume of tissue than in the scan case. In unscanned modes, the highest temperature increases is found between the surface and the focus. In other words, the hottest point is along the central axis of the beam and proximal to the focal point, but not at the focal point. Thank you.